would you like to tell us about subluxation today?
Well, today we're going to talk about the atlas subluxation complex. And I'm glad you brought up that word subluxation because a lot of people don't know what a subluxation is. But we're going to talk about what the atlas subluxation is. And that we also call that the ASC. And what that is when the first vertebra, there's a little tiny bone at the top of your spine called the atlas, and it holds up your head. Well, it also protects the spinal cord and the brainstem. But when that little vertebra shifts out of place, the whole spine shifts like a stack of dominoes. And the way that'll look is one shoulder will be higher or lower than the other. One leg will be longer or shorter than the other. The muscles become unbalanced, so you'll have tighter muscles on one side of the body than the other. Then the structures of the spine start moving incorrectly and abnormally. And what that causes is arthritis and degeneration when you're out of alignment. So there's a whole cascade of issues that occur as a result of this atlas subluxation complex. But most importantly, what happens, and of most concern, is the fact that your nervous system becomes affected. And your nervous system controls and regulates every function in your body. And what we do at Barone Spinal Care, at the core of what we do, is correct the atlas subluxation complex, the ASC, and it's very unique. 95% of adults have an atlas subluxation complex and don't know it. And we also call it the silent killer because you can be out of alignment for years and years and years, not know it, and then eventually have symptoms, but symptoms are the last thing to show up. So we want to correct people's spines so they function optimally for the rest of their life, and we want to do that with the fewest number of corrections necessary. First, we need to look at where the atlas is in relationship to the skull. And of course, when in a living individual, these two bones are together, here's the skull, here's the atlas, and when they misalign, so one goes to the left of the other or to the right of the other, then obviously we need to get that corrected. And so how do we do that exactly? Well, we have to analyze. And the way we do that is very, very carefully look at where this vertebra is in space. And that's our analyzation process. And by doing so, we can figure out where it is in space, and then with a very gentle procedure, we tap, 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 and get the vertebra back in its proper location in relationship to the skull and the spine below it. So it's really about just giving a gentle correction based on very precise x-rays to get the vertebra back where it was intended by God to be in the first place.
But those are bones. How can just a small tap, tap, tap put them in the right spot?
That is another great question. Well, we use physics and we use leverage so that we basically our calculation tells us the exact point to press to get the most mechanical advantage over the structures so that we can use the least amount of force for the most amount of effect. Number one, when the spine misaligns, the biggest thing to understand is that it affects the nervous system, and the nerves control and regulate everything in the body, as I said earlier. And so what happens is the first set of nerves, for example, go to the muscles of the scalp and the inner ear. And when they're involved, we'll see things like tension headaches, migraine headaches, stiffness in the scalp, ringing, buzzing in the ears. We have another set of nerves that go to the eyes and the sinuses. When they're affected, sinus pressure, allergies, light or dark spots in the vision, floaters in the vision. We have another set of nerves that go to the teeth, the gums, the jaw. When they're affected, we'll see tension in the jaw joint, grinding of the teeth. We have nerves that go into the neck and the trapezius area, and for many people this is a really big problem because you have constant tension at work or at home in your shoulder and neck area. We hear people complaining of this all the time. Well, that's a set of nerves coming out of the lower neck that causes that. We have nerves then that dive into the chest cavity. We have a set of nerves that go to the lungs. When they're affected, we see things like difficulty breathing, shortness of breath, asthma, especially in children. When the heart nerves are affected, we see things like heart palpitations, arrhythmias, high blood pressure. In fact, just in the last 2 weeks, we had one senior whose blood pressure, the systolic blood pressure, which is the highest of the two numbers, was in the 150s to 170 range. And after her first adjustment, it dropped into the 130s, and now it's in the 120s. It dropped so much so that I'm going to be in conversation with her medical doctor to start getting her tapered off of her hypertensive drugs. So that's just one effect that an adjustment can have. We have nerves that go to your stomach, your liver, your gallbladder. When these nerves are upset or irritated, we'll see things like acid reflux, heartburn. We have nerves that go to the colon. When they're affected, constipation, diarrhea. We have nerves that go to the low back. When they're affected, sciatic pain, low back pain, difficulty moving, stiffness. And of course, we have nerves that go into the legs. pins and needles, numbness, knee pain, ankle pain, foot pain can all be a result of a spine that is out of alignment. So the nerve supply, the connection between the brain and the rest of the body is extremely, extremely important. A lot like this plant right here. And you can see the leaves look really good right now. But if we were to cut the connection between the leaves and the roots, where it's getting its nutrients and its water, it wouldn't be too long and you would start to see the leaves wilt. The body's the same way. Cut off the flow between the brain and the body, and eventually the body wilts. We call that disease. The way that these injuries occur is from a fall at some time in our life, usually before the age of 5 years old. Sometimes, as the child's being delivered and they use forceps, that will cause a misalignment of the spine. In fact, we believe that 50% of adults were out of alignment before the age of 10, and a majority of those are actually caused during the birthing process. And if you look at the anatomy of a baby, their head is really big in relationship to the rest of their body. It looks like it's half the size, not quite, but it looks that way and appears that way. Well, you can imagine as the doctor is delivering the child out of the birthing canal, you've got this huge head with this little bitty neck, and that oftentimes will cause the spine to misalign.